Thyroid Disorders by David Sloan. The thyroid is a butterfly-shaped endocrine gland that surrounds the trachea and the neck. The thyroid helps to control many aspects of the metabolism, like respiration, heart rate, muscle strength, body temperature, stimulates the breakdown of fats, and helps with growth and development in children. The thyroid also uses iodine to create its two main hormones, triiodithyronine, also known as T3, and thyroxine, known as T4. The thyroid works by the pituitary gland, which gets stimulated by the hypothalamus. The hypothalamus releases thyrotropin release hormone, also known as TRH. TRH then stimulates the pituitary gland to release thyroid-stimulating hormone, also known as TSH. TSH stimulates the thyroid to create T3 and T4. When levels of T3 or T4 are too high, the hypothalamus limits the release of TRH, which then limits the production of T3 and T4. Please now pause this video and click the link to a video on how the thyroid works down in the description. T3 and T4 are both tyrosine hormones. Tyrosine is a non-essential amino acid which was first discovered in cheese. Tyros is the Greek word for cheese. T3 and T4 are produced by follicular cells in the thyroid. T3 and T4 have similar roles, however T3 is 4 times more potent than T4. However, T3 lasts roughly a 20th of the time. T3 and T4 increase metabolism by increasing body temperature, increasing cardiac output by increasing the stroke volume and heart rate, speeds up the breakdown of food, promotes bone growth and development in children and adolescents, and helps improve the efficiency of the nervous system. Thyroid disorders arise if T3 or T4 are not kept at normal levels. Disorders include hyperthyroidism, where too much T3 and T4 are created, and hypothyroidism, where too little is produced. Symptoms of this include heat flash, trouble controlling body temperature, hair loss, brittle hair and skin, tachycardia, fatigue, insomnia, depression, mood swings, sudden weight loss or weight gain, with trouble controlling metabolism, tremors, goiter or thyroid growth, muscular weakness, and in rare cases atrial fibrillation. Causes of thyroid disorders can be autoimmune, like Graves' disease and Hashimoto's thyroiditis. Thyroid-stimulating immunoglobulin, also known as TSI, is an antibody that attaches to the follicular cells of the thyroid. TSI therefore blocks the receptors for thyroid-stimulating hormone, which then limits the production of T3 and T4. Another cause are nodules. Nodules are growth on the thyroid tissue. There are many types of nodules, including colloid nodules, which are benign overgrowths of thyroid tissue. Thyroid cysts, which are nodules filled with fluid, do occasionally contain malignant components that can damage the thyroid. Hyperfunctioning thyroid nodules cause production of T3 and T4 to increase, which can occasionally lead to cardiac arrest, arrhythmias, high blood pressure if levels spike drastically. Cancerous nodules do occur, but are rare. Less than 5% of nodules are cancerous. Thyroiditis is another cause, which is inflammation of the thyroid. Diagnosis of thyroid disorders are done through blood tests and imaging. Blood tests measure the amount of TSH, T3, and T4 found in the blood. Normal levels of T3 are 100 to 200 nanograms per deciliter. Normal levels of T4 are 4.5 to 11.2 micrograms per deciliter. And TSH levels are normal at 0.5 to 4.5 milli-international units per deciliter. Thyroid imaging can be done using ultrasound, a thyroid scan, or radioactive iodine uptake test, which is absorbed by nodules on the thyroid and helps to highlight the problem areas. Treatment for thyroid disorders are radioactive iodide treatment, which is absorbed by the thyroid and thyroid nodules. Iodine shrinks the thyroid, which has been enlarged due to hyperthyroidism. There are several types of medication out there, with two major effects. Levothyroxine replaces or supplements T3 and T4 for hypothyroidism. Propylthiouracil and methimazole are antithyroid agents which reduce T3 and T4 levels. Surgery can be used to remove nodules on the thyroid, but in extreme cases, a lobectomy or thyroidectomy are required to partially or fully remove the thyroid. The effects of thyroid disorders on exercise depend on if the thyroid is overactive or underactive. In hypothyroidism, the metabolism is decreased, which results in rapid weight gain. Depression can also limit exercise through lack of motivation. Hyperthyroidism involves tachycardia, increased blood pressure, rapid weight loss from increased metabolism, and heat intolerance from elevated body temperature. These all have common results with impaired muscle function, increased perceived exertion, and fatigue. For this case study, there is a 46-year-old female who has a sedentary lifestyle. She is 5'4" and 101 pounds, which is a BMI of 17. This classifies her as underweight. She suffers from hyperthyroidism, which has decreased her body weight. Her resting heart rate is 76 beats per minute, and blood pressure is 122/86 millimeters of mercury. Her father died of a stroke at 57. She currently takes propylthyracil, an antithyroid agent, and propranolol, a beta blocker that lowers her resting heart rate and blood pressure. Her goals are to gain weight, mostly lean body mass. However, at her current weight, any weight gain would be beneficial. She would like to have some more control over her symptoms and feel more energized and less fatigued. She has a total of 4 risk factors, but has been diagnosed with hyperthyroidism, classifying her as high risk. The exercise test selected is a medically supervised 6-minute walk test. This test was chosen as it would test her aerobic fitness levels without overly taxing her heart and raising her blood pressure and heart rate. A 5-repetition max test of some resistance training exercises would help to determine her strength levels without spiking her blood pressure and overly taxing the weakened muscles. Some special considerations for exercise are a high metabolism that increases body temperature, lowering her heat tolerance. Fatigue can also set in very early or even prior to exercise. Fatigue, along with depression, can cause huge mental barriers to overcome when it comes to exercise. Beta blockers suppress the heart rate, making the heart seem like it's working less hard than it actually is. The exercise prescription for her is to exercise 4 to 5 days a week. Every day should have a total of 30 minutes of walking to help increase the cardiovascular system. Day 1 will be a push exercise day, starting with bench press. 3 sets of 10 at 65% of a calculated 1 repetition max. 3 sets of 10 at 65% 1 repetition max for back squat. 3 sets of 10 at 65% 1 repetition max for shoulder press. 3 sets of 10 of assisted dips using a bench. 3 sets of 10 of bodyweight lunges, and 2 sets of 20 at 55% 1 repetition max for overhead triceps extension. Day 2, a pull day, starts with 3 sets of 10 at 65% 1 RM for deadlift, 3 sets of 10 at 65% 1 RM for lat pull down, 4 sets of 20 at 55% 1 repetition max for biceps curl, 3 sets of 10 at 65% 1 repetition max for bent over row, 4 sets of 20 of good mornings, and 3 sets of 10 at 65% 1 repetition max of reverse cable fly. Day 3 is a rest day. Day 4 is a repeat of the push day. Day 5 is a 45-minute run at 65% heart rate, which is roughly 115 beats per minute. However, too much aerobic training can cause more weight loss. Day 6 is a repeat of the pull day. Day 7 is a rest day. With thyroid disorders, exercise can be a huge mental hurdle. Depression and fatigue can lower motivation for exercise, so it is very important to keep a positive attitude and to keep her engaged and motivated. Exercise can help bring some stability to her symptoms and improve the overall quality of her life. Thank you very much. Have a great rest of your day.